someone just asked a question, what hospital would we be catering on? So the UK hospitals mostly are well, predominantly is under the government, which is a National Health Service System, NHS. So NHS is the main bulk of where we require nurses at the moment. There's around 44,000 nurses short on NHS alone. So that's the government sector. On top of that, we have contacts with the private sector. A lot of hospitals here also have, especially here in central London, there's a lot of investors like from Middle East, from America, from Australia, who are investing on the health service as well. So they have their own private hospitals that require nurses as well as what the government requires. So potentially there's a lot of deployment that we can offer you. We can look at the private sectors. I mentioned earlier that I've created my own company here 6 years ago, which I provide temporary nurses for the private sector, which I'm still doing. So some of the nurses who work in the public sector, if they want to experience how it is like working in the private sector, they can work on their days off. If they want to earn extra money, they can either work in their own hospital or they can work in the private sector and see for themselves and experience the difference between the two. And if they decide to move from private to the public sector, it's all up to them. So the world of nursing is a very vast experience when you go to UK, because you've got a lot of choices when it comes to either working in the public or in the private sector. But like I mentioned, I'm just going back to the requirement at the moment is about 44,000 nurses short on the public sector alone.